I'm like, what? It's $1400 to go to the hospital. I'm like, wait, first they don't pay a premium. Okay, are they gonna buy it? So wait, no. We'll go there. It's not a no. It's not a, yes, this is Milk, this is Medicare. They don't make it easy. No, I know. I always said, well,
You gonna touch the Medicare program?
oh, you betcha. Because I know that's inside and out.
That's what you're.
Expert do the talking. Good evening. Welcome to tonight's program on Medicare benefits. This is Marguerite McInerney that we have here this evening to talk to us about everything you need to know about Medicare. We are also streaming, so hi to our YouTube viewers. If you have any questions with the program, Marguerite has her email address here. So please feel free to email her any questions that you have, after the program. So I'll go ahead and let Marguerite take the mic. So thank you there, everyone.
Thank you so much, Melissa. It's always a pleasure to come back to Oak Lawn, where I'm from, and do this presentation for everyone. We would like to be deviating from the presentation a little bit, because we do have people live here that might be asking questions. And, but also, we want to be able to, if you have any questions, maybe you can even email the library, and we can work on that for you tomorrow or later tonight to get those responses back to you. I also have copies of all the handouts that I've done today. And we can also maybe upload those onto the YouTube site for the library. And I can also maybe have that directed to my YouTube site where they can find those documents. So understanding those A, B, C, Ds, X, Y, Zs from Medicare and understanding your choices. So I'm Marguerite McHenry. I am from Oak Lawn, the Palos Heights area also. And basically what we want to do today is kind of demystify Medicare. Try to make it as black and white as possible, educate you about your options, and also let you know what Medicare maybe doesn't cover. The reason why I love to do these is because I'm certified by the government in 3 different areas. A lot of insurance representatives out there are only certified in Medicare Supplement, where you do not have to take any tests. To be certified on the Medicare Advantage plans, or even the drug plans, you have to take an annual test with the government, and you have to take every company that you represent their test. And it's usually a passing of like 85 or 90, like it's not a 60% in the pass. So, and also if you fail too many times, they don't let you represent them. So we want to go over who's eligible for Medicare. And, what are your options? When can you enroll and what your next steps are? Some of you might be familiar with this and other people might be preparing for the future. So Medicare was created, like 56 years ago, and it was based on what was offered at companies as medical insurance 56 years ago. And so it didn't include dental, vision, and hearing. It just was the most average plan across the United States. And it was for people 65 and above, or people that became disabled prior to the age of 65. Supplemental insurance plans, kind of started later. Some of them at the same time. Some of them did start at the same time that Medicare did, but it became standardized. And I'll go through that as to why that's important. Then, of course, we added on the Medicare Advantage plans in 1997, the drug plans in 2003, and then in 2010, the Affordable Care Act for people under 65 or that are not on Medicare to be able to join. So basically, Medicare is created as a federal health plan, and so it's the same across the United States. And also the premiums that you pay, it doesn't matter whether you live in Chicago or whether you live in Florida or wherever, it's the same rate. So it's not specific to the state, it's federal across the board. It is individual health insurance. You don't necessarily, become Mr. and Mrs. on the same policy. You each have your own individual policy, which means that there's a company or a plan that's maybe better suited for your spouse than you, then that is your option as well. Funded by taxes that you have been paying though while you've been working. So again, we've gone over, you have to be a US citizen or a legal resident for 5 consecutive years, 65 or older, or with a qualifying disability. And in Illinois, that usually means that you have to be declared disabled by the state of Illinois for a minimum of 24 months. And then on the 25th month, you're actually put onto Medicare. Okay, and anybody that's on dialysis. What are my coverage options? So here we go through the fun thing. You think they would have been a little bit more creative than A, B, C, but A, we just have to go with the plan. So we have got Part A. If you think about Part A, think about an A-frame house. And an A-frame house is a building. And so I like to say that that's the hospitals, that's the rehabilitation places. That's, that is inpatient care. And that used to be the most popular thing. And so when we say, oh, I don't pay for Part A, you don't, because you've usually worked enough time. However, in my handouts, I do try to show you that there is a premium associated with it if you have not worked for 40 quarters. So that typically means if you've worked for 10 years, you've paid your taxes. But there is a point in which if you did not work for 10 years, Part A does have a premium. So in 2021, if you do not have any work in the United States and for some reason you're not covered by it, the premium is $471. And if you did work for almost 40 quarters, but not enough, between 30 and 39, you pay a partial premium of $259. And so for the most part, it's very, very rare I ever meet anybody that does not have Part A paid. Now, for Part B, we look at that and we say, oh, what's that? Okay, that's the hospital, that's outpatient services, that is physical therapy, that is blood tests. So that's all that stuff. And we usually have an association with Part B for a premium. And every year that premium goes up slightly. So this year in 2021, it's $148.50. And you can choose to have that come out of your checking account or your Social Security. And for people that are retiring now, they might choose not to have their Social Security turn on at the same time at age 65 that Medicare does. They might want to postpone that, or it might not even be available really fully to them until they're 67 or so, or 66 in a few months or something. So with that, we want to just reiterate that Part B is outpatients and tests, and that's becoming more and more popular. When Medicare started, we had a lot of these services that are now done outpatient, inpatient. So one of the things that we now can go into is I kind of call it either a 3-part plan or a 1-part plan. But that's the easiest way to discuss things. So we have the Medicare card. And in the old days, before Medicare Advantage or the drug cards, you just got the supplement. Now, what's a supplement? The supplement just takes care of what Medicare doesn't take care of. And Medicare does have some deductibles, but pretty much Medicare pays for about 80%, and the supplements would take care of the other stuff. When they first started out, there was only A, B, and C. Because A took care of X amount, maybe some deductibles if you paid the 20%. B did a little bit more, and C did a little bit more. So to this day, you have to, all companies that sell supplements must have an A plan and a B plan, but they've done away with C, D, F, we'll get to those. But if people are on those plans, they can never be kicked off. So now we know that in 1997, this thing called a Medicare Advantage plan was brought out. And originally they probably got a bad rap. They were mostly HMO only. So in fact, they actually were HMO only. And the networks were really kind of small. So where they became more and more popular was really in the areas like Cook County and Chicago, where we have just such a great variety of resources for us here. And with the Medicare Advantage plans, in order for them to entice you to kind of try out their company, they would say, hey, we're going to give you some dental, some vision, transportation, over-the-counter money to use towards your Bengay and your aspirins and whatever. And then they also, once the Part D, the drugs became available, then they usually included that. And so a lot of times you hear on TV, there's no extra premium. Well, in addition to your $148.50, that is for your Part B, as in the Part B for the regular Medicare. You never lose any of your legal resources that are from Medicare, ever. So being on a Medicare Advantage plan, if anybody tries to tell you, oh, you can never get out of it, oh, no. Okay? So first and foremost, you're either on a 3-card plan, you're on the Medicare red, white, and blue card, the A and B. You're maybe on a supplement, and then you do legally need within 60 days of turning on your Medicare a drug plan. Or you could do the 1-card plan, which a lot of people are used to these days because they have the 1 card at work where it covers their ER, their hospital, their doctor visits, their lab work, and their drugs. So they kind of like those a lot. So we're going to go on there now. We're going to kind of focus down maybe a little bit more. Woo, I think I've covered all these. Okay, so what people don't know about is that Part A and Part B, guess what? They have deductibles. And Part A, if you actually went to hospital and you didn't have any supplement plan, this year in 2021, it would be $1,484 deductible. And that would be whether you're there 1 day or up to 60 days. After 60 days, it's $371 for insurance per day. And 91 days beyond, it's $742 for insurance a day. Now, in the past, again, we didn't have a lot of outpatient services. So when you went to hospital, you were there for 3 days, 7 days, whatever. And when you paid that deductible, which was a lot lower than $1,484, that took care of everything, every test, every blood transfusion, every aspirin that they gave. Okay, but nowadays it's a miracle if you can stay 3 days. And also associated with that in Part A is the nursing. See if we can go on. Okay, thank you. So with Medicare Part A, again, with the hospital side, there's no out-of-pocket. There's no out-of-pocket limit. Okay, so Part B, we've got the premium, and we've also got a deductible. It's $203. Once you pay the $203, then you're kind of an 80-20 split. Medicare pays 80%, you pay 20%, but again, there is no out-of-pocket limit. What does that mean? That means that most of us might be used to work where we have maybe a deductible, but we also have something called MOO, the maximum out-of-pocket, which could be, $7,000, whatever it is. But the agreement is that when you're on that plan, when it gets to be October, and if maybe you had something serious happen to you and you hit your maximum out of pocket, actually no matter what time of year it is, then the company that you've insured yourself through pays everything. But on January 1, Cinderella loses her slippers, right? And everything goes back to 0. So we've got the premium. We know that we have to pay that pretty much monthly regardless. The deductible, that's increased every single year by Medicare. So we have a deductible for the hospital and a deductible for the Part B. You have a copay. So again, typically Medicare pays about 80%. You're going to pay the rest of it. And a copay is a set dollar amount. So it's $10, $50, whatever it is. It's not $20.95. It's set. And then the co-insurance, that's where you might get these weird little numbers because it's a percentage. And so again, we get back to about that 20%. So what I say is that you've got 2 options. You've got the 3-card option, option 1, which a lot of people are used to, and then you've got option 2. So why would you choose one over the other? So the supplement plan, which again has been out since Medicare was started, is really what people are used to. So with the Medicare insurance plans, most people had something called Plan F, as in Frank. And Plan F is available, but you have to have been 65 before last year, June 1st. And the reason most people are moving over to Plan G, which is exactly the same as Plan F, is for two reasons. One, the people on Plan F don't ever pay it. And the government wanted you to have a little bit of skin in the game. Because remember, the government pays 80% of all the bill. So people kept going to get referral, oh, I'm gonna over here, I didn't like the response, I'm gonna go over here. So the government was still paying 80% of all this. So the government said, right, we're gonna have you guys pay the deductible. And so Plan G is exactly the same as Plan F, except you do need to pay the $203 deductible this year, and it's gonna go up slightly next year. Now, a med supplement, as we showed in the very beginning, there's finally, across the board, again, federally, a Plan F is a Plan F, whether you live in Chicago or Los Angeles. So what does that mean? Whatever plan you're looking at has to have the exact same benefits for anybody anywhere in the United States. However, the price that they charge you is going to be depending on the cost of services in your area and maybe also, your age when you were born. However, once you join a Medicare supplement plan, they cannot kick you out for any reason other than you forgot to pay the bills. So with the Medicare supplement, the agreement is with a private company. So it doesn't have to be with a Blue Cross or something like that that you're familiar with. It could be with a credit union. It could be with a bank. It could be with another insurance company. So, and I'm not trying to favor any company by dropping a name here and there. I'm just trying to say that it doesn't have to be a health insurance company because it's a private agreement between you and that company that you pay them a premium, they pay your bills. Okay? So, Plan G is standardized across the nation, and it's going to cover all your expenses that Medicare doesn't, except for the $203 deductible. And they were very popular in the old days because they were the only things that covered you if you were traveling, right? And so you needed a nationwide plan if you were going to be traveling around the United States, even overseas. So that's why they were so important. So just remember that whether it's Plan F, Plan G, Plan K, L, or N as in Nancy, that they're the same nationwide, exactly the same, but the price that you pay for it depends on your area. And also, if you're on a Medicare supplement plan, they cannot say, hey, you're kind of sick this year, so we're going to jack up your price. It is not able, they're not able to do that ever. They can only increase the price for the whole county. So, and it's not just, people, of this age group, it's the whole county has to have a certain percentage increase. Now, do they only raise the price once a year? No, they can raise the price as many times as they want in the year because it's this private agreement between you and this other company. However, what people don't know is that sometimes at the age of 70, maybe 75, you get a couple extra birthday gifts where they say, okay, here was our annual increase in your premium, and then this is your birthday increase. And so with Medicare supplement plans, they're really great for people with maybe conditions that they're already managing before they're turning 65, before they're coming on to Medicare. But really, it's up to the individual. And so we just want to say that there's nothing wrong with your decisions and your choices. But within the Medicare supplement, there are different plans out there. Plan G is the most popular one now. Plan N is the second most popular. And Plan N, again, there's no set network, right? For any of these supplement plans. It's a nationwide plan. You go to any doctor nationwide for your supplement. If you want to get your hip replaced in Arizona, go for it. Okay? And all the doctors that accept Medicare accept the price that Medicare has determined. Okay, so they cannot say, oh, no, I want to charge $1,000 for that one. And they can't. Okay. You have to have A and B in order to get on with your supplement. So now we're going to go into the drug plans. Okay, here we go. So drug plans were created by George Bush. And people get upset sometimes about the drug plans. However, prior to the introduction of Part D for the drugs, there was no help. Everybody just paid cash for their drugs. And there was no selection of kind of generic versus brand. So when we talk about the tiers, again, this is a nationwide program. So some company can't have 2 tiers and another company have 10. They all have 5 tiers. Some drug plans might have a 6th tier, and that is very specific medicine. It's usually maybe insulin that's on the 6th tier. So it's just a very specific group, and not all plans have it for a very specific reason. Tier 1, those are your most popular generics. A lot of times those are 0 copay, maybe $4. And again, every tier is controlled by the government, meaning you can never pay $40 for something on tier 1. It's going to be a range between 0 and maybe $10. Tier 2 is going to start maybe at $4 and maybe go up to 15, 18, depending. Tier 3, whenever I meet with people and they say, do you take any drugs that are about $40? And I know they're on tier 3 because that's, again, controlled. They can't be charged $800 for something in tier 3. So tier 1, most popular generics. Tier 2, maybe second most popular generics. Tier 3 is usually a brand name. And brand name drugs, whenever you look at a formulary, which is a list of drugs, brand name drugs will always be in all capitals. Okay, generic drugs are always written lowercase, but brand name drugs are always in capital to let you know that that is a specific drug. And a lot of times, the newer drugs that come out, they have a patent for their brand name drug, and until that patent expires, there can be no introduction of a generic. So what the government does want to educate you on is that, a lot of generics are out there that do the same thing, and they do want you to try them out. They just don't want you to be, try only brand name drugs. And again, the reason is because there is a payment system here that is a combination of the government, the insurance company, and you. So it's not just you by yourself. What we also have is that the benefits can change every year. So every year the deductible goes up. Starting January 1, it's going to be $480. This year it was $445. And I remember not too far ago, it was only $200. So it's a real change. However, what has happened as well is that more and more drugs are on the generic. And they also have something called the gap, also known as the donut hole. And people fall into that donut hole later in the year. And in the donut hole, you used to have to pay like 50% of the drug cost. And now it's a flat 25% when you fall into the donut hole. They can't, again. And then also there's a limit where you bounce out of the donut hole into catastrophic. And then that's when you're paying like $3 for a generic and $9 for a brand, or 5% of the price. So coverage is not automatic, meaning that if you forget, you turn on your, like my mother, she turned on her Medicare and she was totally healthy. She's like, I just take vitamins. What? I'm not going to pay for a drug plan. So if you don't, you start to incur a penalty. And they did a really bad job when this first came out. They said, you have the option to take this Part D drug. They didn't actually say you have the option to take the drug plan or have a penalty for the rest of your life. So, and it works out to be between $3 and $4 for every 12 months that you are off. There's a specific calculation. I won't get into it, but it's not just $3 or $4 every 12 months if you're not on a plan. For example, my mother, she pays $16 more per month for the exact same plan that my dad had. Why? Because for 4 years, she did not have any drug plan, so she has this penalty, and that's what she paid in addition to any premium for her drug plan. So every year, I get to hear about it. So, and it's exciting. So, we do encourage everybody to maybe look at their drug plans every year. Again, that deductible goes up. And also, sometimes newer drugs come out. And there might be one company that's partnering with that specific drug, and there might be a different company that you are already on that maybe is not participating with that drug. Or that drug is on a tier 4, which is $100 a month and not $40. And of course, I'm just kind of communicating averages here. So let's go. Okay. So when we talk about the deductible on a drug plan, there are drug plans out there. And these usually are only through health insurance companies. And every health insurance company is only allowed a maximum of 3 drug plans in each market. So it's usually entry level, mid-level, and high user level. When we talk about the deductible, there's a lot of companies out there that have entry-level drug plans that are between $10 and maybe $20, that they don't charge you that $480 deductible until you maybe have a tier 3, 4, or 5 prescription. So if you're on generics, well, I'm going to work with you to make sure you're not on a plan that charges you the $480 deductible on your first day that you get a script on June 1st. Other people, though, maybe we can have it be, $60 to $100 a month, and they never pay any deductible. And then they also know that all the drugs, it's a set amount per month that they're managing. Okay. Oh, here we go. Yes. So the deductible, this is last year's numbers, anywhere from 0 to 445. Next year is 480. These are also a little bit higher. This year, your drug limit, you fall into the donut hole. Oh, I don't have the new numbers for next year. It's 4,130, and you bounce out at 6,006.5. It will go up ever so slightly, and when you hit the catastrophic phase, it will be, I think it's 385 next year, and 945. I do apologize. I don't have all these little numbers in my head. I have to write them down to remember. So now let's get into advantage. So this was an ugly word a long time ago, as I said. They were small networks, they were HMO. So in the recent years, it actually come out with PPOs. And even 10 years ago, we had PPOs, but they were, $100+ a month premium. And the difference between an HMO and a PPO are really that an HMO, they want you to stay within the network. If you go out of the network, you would have to pay 100% of everything yourself. No. Okay, so let me take a step back here. They can charge a premium per month. They can charge a deductible. It's a great one-card system. And now most of them include drug plans. And again, there could be a deductible or not. Every county every company that sells within every county has to have the government approve these plans. So whether it's a drug plan, standalone drug plan, or a Part C, which I call the complete plan, the complete card plan, these guys go into the government in March to get approved. They are approved by, let's say, end of May, June. Then they have to go to the publisher to get everything printed out so that we can have things either digitally online by October 1 or physically. So it's really funny because sometimes it's all kind of delayed there. There are several different types of plans. The most popular ones are HMOs, the health maintenance organizations, and preferred provider organizations. There are more and more special needs plans that do cater to people that maybe have a specific ailment like diabetes or even a heart condition or COPD. Other ones might be what is called an HMO Point of Service, HMO POS. Those were the alternatives prior to a PPO. So point of service meant that you could go out of the network, but you would just pay more money. And I also want to say that in the old days, your HMO was kind of like, ooh, Cook County, right? And so now we've got companies that are nationwide. And so their network, even if it's an HMO, is most of the time nationwide. So places like the Mayo Clinic or the Cleveland Clinic can actually be in their network, even though you live in Cook County. So if that is something that you need to consider, it doesn't necessarily mean that you have to do a Medicare supplement or even a PPO plan. You just have to look up the doctors and the hospitals in the specific company that you're looking at. Okay, and then we have private fee for service. What does that mean? It's like a dime dinosaur, right? So it is specific in other areas that are more remote, and it actually allows them, a freer services. So they can go to a doctor and they can say, hey, you take this card, and the doctor just has to agree. So they're not necessarily a set network. Okay, when can I enroll? October 15th to December 7th, everything becomes effective January 1. You also have your initial enrollment period. So when you go to turn on your Part B, you have the 3 months before you turn 65, or that you turn on your Part B, the month you turn it, and then 3 months afterwards. So people say, hey, but I'm still working. Well, what will happen is that your Part A, that you don't pay a premium for those hospitals, skilled nursing facilities and stuff like that, those usually go on when you turn 65. But they just kind of sit there because you're still working and you can't double dip, okay? So you, the Part B won't go on until you say, okay, I'm done with my job and I'm officially now going to start paying that premium. So that's when the drug plans need to be considered, or the Medicare Advantage plans need to be considered. There's also something called special enrollment periods. So what I want to say is that anybody on a Medicare Advantage plan, again, in the old days, they used to say, oh my God, if you go on that, you can be different. But that's incorrect. So January 1 to March 31, every single year, you can actually say, hey, Marguerite, you know what? I've tried this out. For whatever reason, this Medicare Advantage plan isn't working for me. And we can exit stage left, put you just right back on, you're using the red, white, and blue card, and we get you a drug plan, and then if you choose, a Medicare supplement. Also, if you're on a Medicare Advantage plan and you're like, hey, Marguerite, I really want to do this HMO, but I just need a little bit more flexibility. So can you look at some PPO plans? And it can be within the same organization or a totally different organization. So, people saying that you don't have flexibility, that's incorrect. Also, the first year that you try a Medicare Advantage plan, you have the whole first 12 months to exit stage left. So, special enrollment periods are usually when you move. If you do move out of the area, so let's just say you move from Cook County to Kankakee, that actually could be a totally different plan. So, we need to consider that. And of course, if you move over state lines, that might be different too. However, I will tell you that if you have friends in Northwestern Indiana, there are some companies that let you come all the way downtown and use all the big hospitals down here that are a Medicare Advantage plan, and they let you cross back and forth. So it's really, really interesting. They're becoming more and more flexible these days. So when it comes time to you to consider, okay, I'm going to continue to work, but my wife is turning 65, she's not working, it might be better for you to look at the options that you have for Medicare, because it might be a more fiscally economical situation to maybe have your spouse go on to Medicare. But that's within your own choices and you aren't forced to make that decision. So we could pull up my other stuff. I just want to say two more things because I want to take questions. First things first, you all might have been receiving in the last 2 weeks a brand new 1/2-inch thick book of paper called the Medicare and You Book 2022. And it looks surprisingly just like last year's 2021 and 2020. So the funny thing is that it isn't. There are some things in there that are relevant for 2022. I want to have people, I wish there's no way that we can upload any of my other files. Or no?
I mean, I can, it just won't stream.
It won't stream.
I have to start a whole new stream, yeah.
Okay.
But we can put them up when we're done if you want.
Okay. Well, I just want to point out that in Medicare and You Book, on page 5, it does actually talk you through in a real simple one page, what are the differences between a regular Medicare and Medicare Advantage. Then also on page 54, it goes through a list of what is covered for your annual yearly wellness visit. So in the past, Medicare was just a reactive organization. They said, welcome to Medicare at age 65. You went in, you had all your tests done, and told you, woo, you're either good or no. And then they said, thanks for coming. Like, that's it. So when the Affordable Health Care Act came into existence in 2010, what they were doing for people 65 or under 65, they had to do above as well. So that is why now you get an annual wellness visit with your Medicare. Now, before that, the only companies doing that were the Medicare Advantage people. Because Medicare Advantage plans were created to keep people healthy. They weren't reactive, they were proactive. And that is why these Medicare Advantage plans, as you see advertised on TV every 10 minutes, we've got gym memberships, we've got transportation, we've got over the counter, dental, vision, hearing, like you name it. They even have more services. It's just incredible. So if it's right for you, those might be the right things, and that's where somebody comes in to just discuss it with you. And if we go through your plans and we say, hey, what you're on is really the best thing for you, don't change a thing. Then don't, But what is not covered by Medicare Part A and Part B? Currently, dental, eye exams, dentures, cosmetic surgery, massage therapy, routine physical exams, hearing aids, long-term care, concierge care, and cover items that might be suggested by your doctor but aren't covered. So, long-term care. Let's just remind you that Medicare does help some people with long-term care. However, you need to be on what's called Medicaid. And Medicaid, you basically have to spend all your money. And they also started a 5-year look back several years ago because people were being very creative on how their parents could will them everything and become destitute but still live in a pension. So the government decided that they would start to do a 5-year look back to make sure that wasn't people being taking advantage of the organization. Also on page 91, we have getting help with paying your health and drug costs. So this next year, if you're a single person and you make less than $19,320 and you have resources less than $14,790, we can give you some assistance for paying your drugs. And also married persons, it's typically an income level as well as an asset level. They're not allowed to look at your burial, life insurance, your home, your car, but they can look at anything like your 401k, any CDs you have, anything like that. Okay, and then on page 111, there's a brand new thing that the government brought out about a year and a half ago, and that is called the blue button. Now, I'm not so excited about this blue button because it makes you create your own access to Medicare, which is fine, because if you actually create your blue button and you go and you create your own account, you can see all the payments, whether you're on an Advantage plan or anything. Shows you everything, the whole history. You can go in there and you can put all your drugs. And then every year you can just kind of go back and, add what's changed and run a list and kind of see if you need to look at changing that. However, you need an email address. And so for a lot of the older population, they don't have that. And so using this brand new blue button is great for those of us that have an email and regularly look at it and know the password to get into it, right? But the older generation might not be so attuned to that. I want to also mention that when we talk about Medicare Advantage plans, there are sometimes when we cannot help you, we can't even look at them. And when is that? That is if you're on a union, a lot of times, or work for the federal government, state government, or county. Because if you've been working for them, sometimes part of your retirement is paid for by them. And so if you sign up for another plan, supplement or Medicare Advantage plan, it could kick you out of what the retirement plan is. So we always encourage you to make sure that there's nothing changed, and with the HR people, what services they're providing and whether that's included in your retirement. Now, some companies just give you X amount of dollars per month. And you might be more free to choose what's best for you, or like for the city of Chicago, when all the firefighters and the police and everybody that was retired got kicked to the curb, the union for the fire department and the police department got together and they worked with a company to get a specialized plan for their people. So let me just try to answer some questions that we have here. Anybody? Yes, go ahead. Yeah, go please.